Did you know bladder cancer is more common in men than women? Quite intriguing, right? Bladder cancer is a serious condition that typically arises in individuals over the age of 55. It predominantly affects men, but women are not immune to it. This disease can take on two main forms: invasive and non-invasive. Invasive bladder cancer is one that has spread to the muscle wall of the bladder or beyond, making it more challenging to treat. Non-invasive bladder cancer, on the other hand, is confined to the inner layer of cells lining the bladder. Both types have different implications and require different approaches to treatment. Bladder cancer is a complex disease, and understanding it can be the first step towards prevention and early detection. It's important to be aware of the risks, symptoms, and treatment options. Stay tuned as we delve deeper into the risk factors of this disease. Ever wondered why some people are more prone to bladder cancer than others? It's a question worth exploring. The primary culprit is tobacco smoking. Yes, those cigarettes not only affect your lungs but can also lead to bladder cancer. But it's not just smokers who are at risk. Certain workplace environments can also be hazardous. For instance, those in the leather, rubber, textile, metal, and petroleum industries may be exposed to chemicals that increase the risk of bladder cancer. Here's the real kicker. These factors can influence the development of the disease even many years after exposure. So, that job you had in your 20s or those cigarettes you smoked back in college, they can come back to haunt you years down the line. Understanding these risk factors is crucial in preventing and early detection of bladder cancer. Now that we know the risk factors, let's move on to how the disease manifests itself. Just like a crying baby signals it's time for a diaper change, our bodies also send signals when something is off. And when it comes to bladder cancer, it's no different. The symptoms can vary from subtle to severe, often starting with the most common one: blood in the urine. This condition, known as hematuria, might not always be visible to the naked eye, but it's a red flag that something could be wrong. But it doesn't stop there. Other symptoms may include a frequent urge to urinate, a burning sensation during urination, or a feeling like your bladder isn't completely empty even after you've gone. As the disease progresses, you might experience lower abdominal pain, difficulties in urination, and even lumbar pain. In advanced cases, symptoms related to distant metastases, such as bone pain, may occur. These signals from our bodies should never be ignored. But how do we confirm if it's bladder cancer? So you've noticed some symptoms and you're worried. What next? Diagnosis starts with an ultrasound, which gives a detailed view of the bladder. A urine sediment cytology test is then performed to check for abnormal cells. Finally, a doctor may use a cystoscopy to examine the bladder's interior. Once diagnosed, treatment is based on the disease's stage, ranging from surgical removal of the tumor to radiotherapy, chemotherapy, or immunotherapy. Diagnosis and treatment are vital steps, but what can we do to stay ahead? Early detection and prevention are our best tools in the fight against bladder cancer. Regular screenings play a vital role, notably for those at higher risk, such as smokers or those exposed to certain workplace chemicals. Never underestimate symptoms. Even minor changes could be a warning sign. Alongside screenings, a healthy lifestyle can significantly reduce your risk. This includes quitting smoking and reducing exposure to harmful chemicals. Remember, your health is in your hands. Regular screenings and a healthy lifestyle are your best defense against bladder cancer. Stay healthy.